You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. Roland Martin Unfiltered. All right, folks. Dr. Alexea Gaffney, she's an infectious disease specialist, joins us right now to talk about the potential medical consequences if our economy opens too soon. Even Dr. Anthony Fauci has made it perfectly clear this could be disastrous. Other people have said the exact same thing. And so would you be advising this administration to put a pause button on reopening these states?
No, it's not advisable at this time. People are, suggesting that we've reached the peak, meaning the maximum number of patients being diagnosed per day of this infection. But we don't know if we reached the peak or not because we don't have mass testing in place. We're not testing our entire population. We're testing the people that are the sickest with this infection. So we still have to keep in mind that there are people who have no symptoms, who have this infection, who are perfectly capable of transmitting the virus to other people. So if we return to business as usual, or even if we do slowly returning to business, opening up only certain businesses, what we're doing is opening up the population to more exposure, and we're going to see an increase in the number of infections.
So when you look at this decision by Governor Brian Kemp of Georgia, nail salons, barbershops, allowing people to worship in place, bowling alleys.
Yeah, a bowling alley is the nastiest place to go to. You're touching the balls that have been on the floor that tons of people have cut that are not routinely cleaned. Like, what is essential about a bowling alley? And quite frankly, like, hair salons and barbershops, that's close personal contact with someone. That's someone standing in your face, standing over your head for several minutes, an hour at a time. A mask is going to be in the way. What is the odds that anyone is going to be silent and not talk to one another during that time? It makes no sense. It's unsafe. It's dangerous. And it's putting lives on the line. And think about who works in the hair salon, who works in the nail salon, who is running these types of business, and who is going to be most gravely impacted. It's people like us who are going to be most infected and affected by this virus. And on top of who's going to be infected, if the numbers rise again, we've already proven that some of our healthcare systems, or that our healthcare system is ill-equipped to handle a massive influx of patients. And that's what we're going to be facing again.
Obviously, if that's so what you're seeing here, the White House, by trying to say, well, it's the governor's call, they're putting it off on them, but it's the White House is offering the guidelines. And so that's really where they're taking their lead from.
Yeah. And everybody is passing the buck. Everybody is like pointing fingers and saying, well, he made that decision. She made that decision. I didn't make that decision. It's a setup to not take responsibility for when things go terribly wrong.
Obviously, if you're in a place, if you have a business, you want to be open, you want to be able to generate revenue. If it's a black-owned business there in Georgia, and you are still seeing what's happening in your state, would you be advising those folks not to reopen their business?
That would be my advice. I would not return to business as usual. If we return back to business as usual, we know that people are still infected in the population. We know that some of those people may be mildly ill or not have symptoms. It's just going to cause a rise in the number and the incidence of this infection. And then the more people that are infected, the more people we have pouring into our healthcare system, and it's going to be disastrous.
So let's say somebody does reopen. If, let's say, barbershops, okay, let's say hair salons. What protections should those folks who are doing hair, should they be wearing? Gloves, mask, suit, covering their face, covering their head? I mean, what should they be wearing?
So, I mean, there's not even like a standard answer for that, right? Because we've gone on the guise that we should be maintaining social distancing, and we've suggested that people wear masks and gloves outside of their homes, assuming that they have the potential to spread infection or the potential to become infected. The types of equipment or gear that you're speaking of, personal protective equipment, is really for the healthcare setting, goggles or face shields, full body suits, um, you know, N95s and gloves or surgical masks and gloves. And so it's really hard to say, okay, if you're going to go open your beauty salon and you're going to do hair, you should wear X, Y, and Z. Well, to me, yes, if you take that risk, you should protect yourself to the fullest extent. But these types of measures that we take in the healthcare setting they're not meant for use in the general public. And we don't even have access to that in the general public. So I could say that if I was a beautician and I was going to go do someone's hair who I'm standing face to face with, or who I'm standing behind, or who I'm leaning over when I have their head in the basement and I'm washing their hair, what would I wear? I would wear a face shield. I would wear N95. I would cover my own hair. I would wear some sort of covering over my clothing. But these aren't measures that are meant to be taken in public. We should just not go to work. We should maintain the social distancing.
All right. Well, we certainly appreciate it. Thank you so very much for joining us. Hopefully people will pay attention. Dr. Alexea Gaffney. Thanks a lot.
Thanks for having me.
I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.